There's a simple test doctors quietly use in exam rooms, one that takes less than 60 seconds, and it can reveal more about your long-term health than almost any blood test we run. No needles, no machines. Just your own body, doing something most men stop being able to do somewhere in their 50s or 60s without ever noticing it slipping away. If you can still do it today, at 60, 65, 70, or beyond, research suggests you may be in noticeably better physical shape than most men your age. And if you can't do it quite as easily as you used to, I want you to know that's not a verdict. It's simply information. Valuable information you can act on starting today. Stick with me through this entire video because I'm going to walk you through 7 of these simple physical markers. One by one, explain exactly what they may indicate about your strength, your balance, and your long-term health. And most importantly, what you can do if any of them feel harder than they should. Number 1 on this list, the very last thing I'll share with you today, is the one physical therapist tell me predicts independence in your 80s and 90s more reliably than almost anything else. Hello, and thank you for spending this time with me today. I'm Dr. Richard Williamson. I've spent more than 20 years working in emergency medicine, and over those decades, I've come to notice something fascinating. Age alone doesn't tell you nearly as much as you'd think about a person's actual physical resilience. I've treated men in their 50s who moved like they were 80. And I've treated men in their 80s who moved, quite honestly, like they were still 55. The difference usually isn't luck, and it isn't just genetics either, though that certainly plays some role. Very often, the difference comes down to a handful of physical capabilities. Capabilities that quietly reflect years of maintained strength, balance, and mobility, or in some cases, years of gradual decline that nobody addressed early enough. Today, I want to walk you through 7 of these physical markers. Simple, doable, things you can actually test right in your own living room, right after this video if you'd like. I'll explain what each one means, the science behind it in plain language, and most importantly, what to do if you find one of these more difficult than you'd hoped. Before we begin, I want to be completely honest with you. This video isn't about comparing yourself harshly to other men your age, and it certainly isn't about feeling discouraged if some of these come more easily than others. Physical capability changes for many reasons. Previous injuries, certain health conditions, medications, and simple genetics all play a role. Everything here is general information meant to inform and motivate you, not to diagnose you. If any of today's tests reveal something concerning, please talk with your doctor before making significant changes to your activity level. They know your specific health history far better than I possibly could through a video. Let's begin with number 7. Number 7 on our list is the sit-to-stand test. And I want to start here because this simple movement, something we all do dozens of times daily without thinking, actually reveals quite a lot about your leg strength and overall functional fitness. Here's the test itself. Sit in a sturdy armless chair with your feet flat on the floor and your arms crossed over your chest. Then, stand up completely and sit back down again as many times as you comfortably can within 30 seconds. Here's what the research generally suggests. Men in their 60s who can complete somewhere around 12 to 14 repetitions in 30 seconds are often demonstrating leg strength associated with better functional independence as the years go on. Men in their 70s, generally somewhere around 10 to 12 repetitions, reflect similarly encouraging strength. Now, here's the science, simplified. This movement primarily relies on your quadriceps, the large muscles in the front of your thighs, along with your glutes and core muscles working together. These muscle groups are essential for so many daily activities: climbing stairs, getting up from low chairs, recovering your balance if you stumble. Maintaining strength here is associated with a meaningfully lower risk of falls and greater overall independence in later years. Let me tell you about a patient I'll call Daniel, 63 years old, a retired construction supervisor who prided himself on staying active his whole life. When I mentioned this test during a routine visit almost as a passing comment, he tried it right there in my office, out of curiosity more than anything. He managed 8 repetitions in 30 seconds. Not terrible, but noticeably lower than the general benchmark for his age. Daniel, being the practical man he was, didn't feel discouraged. He felt motivated. He asked me directly what he could do about it. We talked about incorporating simple, gradual strength work into his week, nothing extreme, just consistent effort. Squats using a chair for support initially, gradually building toward doing them without assistance. 3 sessions a week, 10 to 15 repetitions each time, allowing rest days between sessions for recovery. About 10 weeks later, Daniel retested himself and proudly told me he'd reached 13 repetitions in 30 seconds. He said the change wasn't just about the test itself, he'd noticed everyday tasks. Getting up from his recliner, climbing into his truck, felt noticeably easier too. I want to reassure you, if your own number today feels lower than you'd hoped, this is simply useful information, not a permanent sentence. Leg strength responds remarkably well to consistent, gentle strength training at any age. An improvement is absolutely achievable with patience and consistency. If you'd like to try this test yourself after this video, please do so safely, near a wall or sturdy furniture for support if needed, and stop if you feel any pain beyond normal muscle fatigue. Now, let's move to our 6th marker, one that involves balance specifically, an area where small changes often go unnoticed until they become significant. Number 6 on our list is the single leg stance test, and this one measures something that becomes increasingly important with each passing year, your balance and stability. Here's how to try it. Stand near a wall or sturdy counter for safety. Lift one foot slightly off the ground, bending your knee, and see how long you can maintain your balance on the standing leg without needing to touch down or grab for support. Here's what research generally suggests. Men able to comfortably balance on one leg for around 20 to 30 seconds without support in their 60s tend to demonstrate balance capabilities associated with lower fall risk. This time generally decreases somewhat with each following decade, but meaningful capability at any age is a genuinely encouraging sign. The science behind this is fascinating actually. Balance relies on a complex coordination between your inner ear, which senses movement and position your vision, and something called proprioception, your body's internal sense of where your limbs are in space, largely governed by nerve signals from your muscles and joints. As we age, all 3 of these systems can gradually become somewhat less precise, which is part of why balance training becomes increasingly valuable, not less, with each passing year. I think of a patient, a man named Arthur, 68 years old, who came to see me after a minor stumble in his garage, nothing serious thankfully, but it concerned him enough to want to address it directly. When we tried the single leg stance test together, he managed only about 6 seconds before needing to grab the counter for support. We talked honestly about this. Arthur, understandably, felt a bit surprised, even a little unsettled, by how quickly his balance gave out. But rather than feeling discouraged, he asked what he could actually do to improve it. We introduced simple balance practice into his daily routine, standing on one leg while brushing his teeth each morning and evening near the bathroom counter for safety, gradually working up his time as he felt more confident. After about 8 weeks of this small, consistent practice, Arthur retested himself and managed nearly 22 seconds on each leg. He told me, with genuine relief in his voice, that he felt noticeably steadier walking on uneven ground during his regular walks, something he hadn't even realized had become a subtle concern until it improved. I want to reassure you, balance, much like strength, responds well to simple, consistent practice. If your own results today feel lower than you'd like, please don't be discouraged. This is one of the most improvable physical capabilities we'll discuss in this entire video, and even small. Brief daily practice can make a meaningful difference over just a few weeks. Now, let's move to our 5th marker, something that involves a movement most men haven't attempted intentionally since their younger years, and one that reveals quite a lot about overall mobility and flexibility. Number 5 on our list is the ability to get up from the floor without using your hands, sometimes referred to informally as the sit-to-rise test. Here's how it works. Starting from a standing position, lower yourself down to sit on the floor, then stand back up again, using as little support from your hands, knees, or nearby furniture as possible. I want to be clear immediately. Please, only attempt this if you feel confident in your balance and joint health, and ideally with someone nearby or near a sturdy piece of furniture just in case. This isn't a test to push through discomfort or risk injury, it's simply informative when done safely. Here's what the research suggests, generally speaking. Men who can perform this movement using minimal hand or knee support tend to demonstrate a combination of leg strength, core stability, flexibility, and balance, all working together effectively. This combined capability has been associated, in various studies, with general markers of physical resilience as people age. The science here involves multiple systems working in coordination. Your hip and knee flexibility allowing you to lower and raise your body through a full range of motion. Your core strength stabilizing your torso throughout the movement. And your leg strength powering the actual rise back to standing. I recall a patient, a man named Michael, 65 years old, who'd always considered himself reasonably fit, regular golfer, walked frequently. When we discussed this test during a conversation about overall mobility, he admitted he genuinely wasn't sure he could get up from the floor without using his hands at all anymore, and hadn't tried in years. We tried it together, carefully, in my office, near a sturdy chair for backup support if needed. Michael required one hand down to lower himself and needed to push off his knee to rise back up. Not unusual for many people his age, but it did reveal some stiffness in his hips that he hadn't fully recognized as significant until seeing it demonstrated this directly. We talked about incorporating simple hip and lower body flexibility exercises into his routine, gentle stretching most days, along with continued strength work for his legs and core. About 12 weeks later, Michael proudly told me he could rise using just one hand for light support, a meaningful improvement from needing both a hand and his knee previously. I want to reassure you, if this movement feels difficult or entirely inaccessible to you right now, please don't feel discouraged, and please don't attempt it if you have any concerns about your joints, your balance, or getting back up safely. This is simply meant to be informative, not something everyone needs to be able to do perfectly. Many wonderfully healthy, active people simply choose not to get down onto the floor regularly, and that's completely fine too. If this test interests you and feels safe for your situation, wonderful. If it doesn't, please don't feel that avoiding it says anything meaningful about your overall health. Now, let's move to our fourth marker, something that involves your grip, quite literally, and something researchers have found surprisingly connected to overall health. Number 4 on our list is grip strength, and I want to explain why something as simple as how firmly you can grasp an object has become such a significant focus in aging research over recent years. Here's a simple way to get a general sense of your own grip strength at home, though I'll mention a proper grip strength dynamometer, sometimes available at physical therapy offices or purchased inexpensively online. Gives a more precise measurement if you're curious about exact numbers. For a general sense at home, try this. Take a rolled up hand towel and squeeze it as firmly as you comfortably can with one hand, noticing how firm and sustained your grip feels, and whether you can maintain that firm squeeze for several seconds without your grip weakening noticeably. Here's why this matters, and the science genuinely surprised me when I first learned about it years ago. Grip strength has been studied extensively as what researchers sometimes call a biomarker of overall health, meaning it's associated in various studies with broader markers of muscular health and, even interestingly, with general markers of cardiovascular health and overall physical resilience as people age. The theory generally suggests that grip strength reflects overall muscle health and neuromuscular function throughout your entire body, not just your hand and forearm specifically. I want to be careful here and completely honest with you. This doesn't mean weak grip strength alone indicates a specific health problem. Correlation in research doesn't mean direct causation for any individual person. But it's a fascinating, simple marker that many researchers and clinicians pay attention to as part of a broader overall picture of health. I think of a patient, a man named Thomas, 69 years old, who mentioned during a routine visit that he'd recently struggled to open a stubborn jar lid, something he attributed simply to getting older, without thinking much further about it. When we discussed grip strength specifically, and I explained some of this research, he became genuinely curious and wanted to address it. We talked about simple ways to maintain and build grip strength, using stress balls or grip strengtheners, inexpensive and available at most pharmacies, squeezing for a few seconds at a time, several times daily. Incorporating activities that naturally challenge grip, like carrying grocery bags rather than always using a cart, or gardening, which involves quite a lot of natural gripping and squeezing motion. After about 2 months of this simple, consistent practice, Thomas mentioned almost with a laugh that he'd successfully opened 3 stubborn jars that week without any struggle at all, something that felt like a small victory, but a genuinely meaningful one to him. I want to reassure you, grip strength, like the other markers we've discussed today, responds well to simple, consistent practice. If this feels like an area of concern for you, please mention it to your doctor, particularly if you've noticed a significant, sudden change in grip strength, as this is worth having properly evaluated to rule out other causes. Now, let's move to our third marker, something that involves a movement pattern most men haven't been asked to demonstrate since gym class decades ago. Number 3 on our list is the ability to touch your toes, or come reasonably close, with straight knees, reflecting overall flexibility through your hamstrings and lower back. Here's the test. Standing comfortably with your knees straight but not locked rigidly, slowly bend forward at your hips, reaching toward your toes, going only as far as feels comfortable without any pain or straining. Here's what this generally reflects. Flexibility in your hamstrings, the muscles running along the back of your thighs, and your lower back. This flexibility is associated with easier, more comfortable movement in daily activities, bending to tie your shoes, picking something up off the floor, and may also be associated with reduced risk of certain lower back discomfort issues that become more common with age. I want to be clear, this test isn't about touching your toes perfectly. Plenty of wonderfully healthy people, even in their 20s and 30s, can't quite reach their toes due to natural variations in body proportions and flexibility. This is simply about noticing your general range and whether it feels significantly more limited than it used to for you personally. I recall a patient, a man named Kevin, 64 years old, who mentioned that tying his shoes had started to feel noticeably more difficult over the past couple of years, requiring him to sit down rather than simply bending over as he always had before. When we discussed this together and tried a simple flexibility assessment, it became clear his hamstring and lower back flexibility had gradually decreased more than he'd realized. We introduced simple, gentle stretching into his daily routine, nothing intense, just holding a gentle forward bend for 20 to 30 seconds most mornings, along with some gentle hamstring stretches while seated. After about 6 weeks of this consistent, gentle practice, Kevin mentioned he could comfortably tie his shoes standing up again, something that felt like a small but genuinely meaningful return to normalcy for him. I want to reassure you, flexibility, perhaps more than any other marker we've discussed today, responds remarkably well to simple, gentle, consistent stretching. If your own flexibility feels more limited than you'd like, please know this is genuinely one of the easier things to improve, with patience and gentle daily effort. Now, let's move to our second marker, something that combines several of the previous capabilities we've already discussed into one practical, real-world movement. Number 2 on our list is your walking pace, specifically how quickly and confidently you can walk a moderate distance, sometimes measured as gait speed by researchers and physical therapists. Here's a simple way to get a general sense at home. Time yourself walking a known distance, perhaps the length of your driveway, or a measured section of sidewalk near your home, at your normal, comfortable walking pace, not rushing, just your natural everyday speed. Here's why this matters, and researchers have actually studied this quite extensively over the years. Walking speed has been found in various research studies to be associated with overall health and functional independence as people age. So much so that some researchers have referred to gait speed as almost a vital sign for overall physical health alongside things like blood pressure and heart rate. The science makes sense when you think it through. Walking pace naturally reflects a combination of leg strength, cardiovascular fitness, balance, and overall neuromuscular coordination. Essentially, many of the individual capabilities we've discussed throughout this entire video, working together simultaneously in one practical, everyday movement. I think of a patient, a man named Richard, coincidentally sharing my own first name, 71 years old, who mentioned that he'd noticed his wife and adult children walking slightly ahead of him during a recent family outing. Something that hadn't happened before and that had genuinely surprised and concerned him. We discussed his walking pace specifically and talked through some possible contributing factors, including some mild joint stiffness he'd been managing and a general decrease in his regular walking routine since retiring a couple of years earlier. We worked together on a gradual walking program, starting with short, comfortable walks most days, gradually increasing both distance and pace as his comfort and confidence improved, alongside some gentle strength work for his legs specifically. After about 3 months of consistent effort, Richard mentioned with genuine pride that he'd kept pace with his grandson during their most recent walk together, something that meant a great deal to him personally, beyond simply the physical improvement itself. I want to reassure you, walking pace, much like the other markers we've discussed, generally responds well to consistent, gradual activity. If you've noticed your own pace slowing more than you'd like, please know this is genuinely improvable for most people through consistent walking combined with some gentle strength work. Now, we've arrived at our final marker, the one I promised you at the very beginning, the one that physical therapists tell me may predict long-term independence more reliably than almost anything else we've discussed today. Number 1 on our list is the ability to carry a moderately heavy load for a sustained distance, sometimes referred to informally as a loaded carry, similar to carrying grocery bags, luggage, or other everyday heavy items. Here's a simple way to assess this at home, though please, only attempt this with a weight that feels genuinely manageable for you. There's no need to test yourself with anything heavy or risky. Try carrying something like a gallon of water or a moderately full grocery bag in each hand, and walk a short distance, perhaps across your living room and back, noticing how your grip, your posture, and your overall stability feel throughout the movement. Here's why this particular capability matters so significantly. Loaded carries combine grip strength, core stability, posture, and overall muscular endurance, essentially nearly every capability we've discussed throughout this entire video, working together simultaneously in a way that closely mirrors real everyday tasks: carrying groceries in from the car, carrying luggage through an airport, carrying a grandchild, moments that matter deeply in daily life. Physical therapists I've worked with over the years have told me repeatedly that this combined capability, more than almost any single measure we've discussed today, tends to predict whether someone maintains genuine independence with everyday tasks well into their 80s and 90s. I think of a patient, a man I'll call Samuel, 67 years old, a genuinely remarkable person who'd maintained impressive strength throughout his life through consistent, moderate exercise. Samuel could easily carry 2 full grocery bags, one in each hand, walk confidently up his front steps, and set them down without any strain or noticeable fatigue. When I asked him about his routine, expecting perhaps an intense exercise regimen, he told me something refreshingly simple. He walked most days, did some basic strength exercises using resistance bands a few times weekly, and made a point of carrying his own groceries and luggage himself rather than always relying on carts or asking for help. Specifically because he'd read years earlier that maintaining this kind of functional strength mattered for long-term independence. Samuel's approach wasn't extreme or complicated. It was simply consistent, moderate effort applied over years, and it showed remarkably in his overall capability and confidence. I share Samuel's story not to suggest everyone should be lifting heavy grocery bags immediately. Please always work within what feels safe and manageable for your own body, and consult your doctor if you have any joint or health concerns before increasing physical demands. But I share it because his story genuinely illustrates what consistent, moderate effort, applied patiently over time, can accomplish for functional strength and independence. If carrying moderate loads feels more difficult for you currently than you'd like, please know, this too is genuinely improvable through gradual strength work combined with the grip strength and core stability exercises we discussed earlier in this video. Let's bring everything together now because we've covered quite a lot today, and I want this to feel encouraging and genuinely useful for you rather than overwhelming. We talked about the sit-to-stand test, reflecting your leg strength and functional fitness. We talked about the single leg stance, reflecting your balance and stability. We talked about rising from the floor, reflecting combined flexibility, strength, and coordination. We talked about grip strength, an intriguing overall marker of health that researchers continue studying closely. We talked about touching your toes, reflecting hamstring and lower back flexibility. We talked about walking pace, perhaps the most comprehensive everyday marker of overall physical health. And finally, we talked about loaded carries, combining nearly everything we discussed into one practical, real-world capability that may predict long-term independence more reliably than almost anything else. I want to leave you with something important before we close today. If you tried some of these tests along with me and found certain ones more challenging than you'd hoped, please, I want you to hear this clearly. That is not a verdict on your health or your worth, or your future. It's simply useful, encouraging information you can genuinely act on starting today at any age. Every single capability we discuss today responds to consistent, gentle, gradual effort. None of this requires intense gym sessions or dramatic lifestyle overhauls. Small, steady practice a few minutes here and there throughout your week genuinely adds up to meaningful improvement over time, as we saw with Daniel Arthur, Michael Thomas, Kevin Richard, and so many other patients I've had the privilege of caring for over the years. I also want to remind you, sincerely, that if you have any existing joint concerns, balance issues, or other health conditions, please speak with your doctor or a physical therapist before beginning any new exercise routine. They can help ensure whatever you choose to do is genuinely safe and appropriate for your specific situation. If this video gave you something valuable today, even just one test you're curious to try, or one small change you're planning to make, it would genuinely mean a great deal to me if you give it a like. It helps this information reach more people who deserve clear, encouraging, medically grounded guidance. And if you'd like more videos like this one, honest, practical, and made specifically with adults over 60 in mind, please consider subscribing. I create this content because I sincerely believe you deserve better, clearer health information delivered with genuine warmth and respect. I'd also love to hear from you in the comments below. Which of these 7 tests did you try, and how did it go? Or is there one you're planning to start practicing this week? Your experience genuinely helps other viewers feel motivated and less alone in this journey, more than you might realize. Take good care of your strength this week. Small, consistent effort, practice patiently, genuinely makes a difference. And I'll see you again very soon, right here. Until then, I'm Dr. Richard Williamson, wishing you strength, steady steps, and good health ahead.